Hi guys, so this is my scan from May of this last year. I thought it was the recent one, but it was labeled incorrectly, so that's my bad. But I can kind of show you from there, from May, how things are looking. So once again, bladder's normal, kidneys normal. What you are seeing here, these are some lymph nodes. These are lymph nodes. This is all lymph nodes up here. Lymph node there. I have a lot of lymph nodes popping up. Actually, this is some that's in the soft tissues around the ribs. So they're not in the ribs, but they're near the ribs. All right. And this is just a little bit of stuff coming up down from the kidneys down to the bladder. So that's normal. Again, brain's normal. And that's always a little bit like that. That's, I think that's tonsils, if I remember correctly. Don't take my word for that. But again, you can see, if you remember my first scan from 3 years ago, 2016, almost 4 years ago, big difference, okay? So this is on Ibrance after so many years. All right, so I kind of give you, so you can see the ones in the ribs here. Yeah. There's the little lymph nodes. Now I have some lung issue, and that's not cancer. That's a little bit of lung collapse, and we're not really sure why that's happening. That's a lymph node. But my doctors are kind of not really too concerned about it, which is bothering me a little bit, but I'm going to have to pursue that a little bit. But you can see that there's lymph nodes to both of those pockets, though, so I'm worried that there might be an infection, and I feel like there's been an infection there for a while, but my body is having a hard time fighting it off. Because Ibrance is an immune suppressor, and now I'm on prednisone, which is like doubling it up. But these are all little soft tissue issues that are not really causing me any really major problems, and haven't grown really. So, and you see the legs, they look okay. There's no big deal there. There's the hips are clear. Remember that first scan I had like little lines of tumors there, and then the spine. Let's see if I can show the spine here. Well, you can see that there was a little tiny speck, but that one kind of comes and goes too. So it might be one of those things where maybe it was inflamed, and that's why it popped up. Now, there's more than one reason why a spot on your body will take up the radioactive sugar. Now, those are cells that are metabolizing quickly, and it doesn't always mean cancer. That's important to understand that. Like I'll show you another scan one of these days where I had a whole bunch of lymph nodes. I mean, they were really just bam bright, and they were just from an infection. So be careful about lymph nodes. Don't let that be the reason why you switch drugs, because lymph nodes can come and go. In fact, they've been doing that to me for years. So just, but if they get into you start growing in your liver, or start growing in your lungs, or anywhere near your brain, yeah, it's definitely time. Or the spine starts getting affected, that's time to consider a change, because the spine and brain, liver, lungs, those are important places. And my cancer has not really bothered me in those areas for the last few years. So that's why I'm not concerned about changing drugs. Even though I get some lymph nodes popping up here and there, and a couple soft tissue ones here, I'm not worried about those. Those are just more of a nuisance than anything. So as long as the other drugs keep on doing their thing, I'm going to keep on using them as long as I can, and hope that things continue to do well. Now there's a little lymph node there. It's under the pectoral muscle. Well, that's the pectoral muscle one. This one's a little lymph node underneath the bone, I believe. But this one here, this lymph node has actually been kind of bugging me a little bit. And it's the last scan, I believe it got a little bit bigger. Not much, but a little bit bigger. And it kind of does seem to impair swallowing a little bit, but not enough to be really worried about it. But I think it's because I do have something in the lungs that's going on, and that's probably also, working into it as well. So anyway, this is a scan from May of last year, at the end of May. All right, and I will show you the most recent one hopefully here soon. Thank you.